Hi, good afternoon, everyone. My name is Liz Deneef, and I'm a member of the Secretariat of Kildare Public Participation Network, or PPN. Thank you so much for joining us on this rainy Sunday afternoon for an event that is part of Kildare PPN's third annual Climate Action Weekend. This session is one of 17 events which are taking place over 3 days. We started on Friday, today is our last day. And they're a mix of online, in-person and walk and talk events. We're very grateful to have a few online events given how the weather has turned against us today. And we are particularly happy that many of these events are being run, delivered and facilitated by PPN elected representatives and member groups. So I might just take a second to tell you a little bit about Kildare PPN. Kildare Public Participation Network has a membership of 861 community groups from the social inclusion, environmental and community and voluntary sectors within County Kildare. There is a PPN in every local authority area in Ireland, and they are funded by the Department of Rural and Community Development, with some funding from their respective local authorities too. Kildare PPN was established to allow communities to have greater involvement with their county council and to give communities a greater voice and influence on issues and policies of interest to them. We know that from speaking to members that climate and environmental action is crucially important to all member organisations, no matter what area they operate in. We're very pleased to have contributions this weekend from organisations such as An Taisce, the SCAI, Codima, the Dublin Energy Agency, County Kildare Chamber, and today we are joined by Consultant Geriatrician and expert in air quality, Dr. Colm Byrne. This shows that PPNs can bring expertise into our communities, while also highlighting the role that our community groups are playing and will continue to play in climate action. Which brings us to this afternoon's event. Air pollution is a major public health problem worldwide, and today's session is about learning more about the effects of air pollution in our towns and villages and what you can do to improve air quality in your locality and mitigate the health effects of it. Delighted to introduce Dr. Colm Byrne today. As I said, Colm is a consultant geriatrician in the Mater Hospital who has recently completed a doctorate in the effects of air pollution on short-term stroke risk in Ireland. Colm is also living in Naas in Kildare and is an active member of Naas Cycling Campaign and critical mass cycle events, and he's a vocal advocate for better walking and cycling infrastructure in our towns and villages, which he wants to make safer and cleaner for everybody. He's also the proud owner of a very cool cargo bike that you'll see him driving around the town with his two lovely children. You'll see him zipping around the town quite regularly. So before I hand over to him for the really good stuff, the meaty stuff, just a little bit of housekeeping. We just ask everybody to stay on mute if that's okay for this session. We are recording the session, just so you're aware of that. We might even take the odd picture. Hope that's okay. And if you have any questions, Colm will be delighted to take those towards the second half of the session. We just ask you to pop them into the chat box and we'll try to get through as many of them as we can. So that's me. Thank you, Colm. I'll hand over to you.
Yes. Let's share my screen and we're good. Thanks everyone for joining. I'm going to talk today about air quality in our towns and villages and what we can do to mitigate that and mitigate the health effects of it. I'm a consultant geriatrician in the Mater Hospital, as Liz said, I'm a local Naas resident as well. And I'm also involved with Irish Doctors for the Environment, who are a group of doctors and health professionals who are trying to advocate and organise for climate action and better environmental practices in our country. So just to start off, Níl Aon Tinton Mar Hinton Féin, everyone knows they're in Satin School. There's no home fire, no fire like your own fire. And I suppose as a way of background for my research, when I started doing research into this in 2018, I was an avid fire burner. I used to go home, you'd get home in the winter, light a fire. We just moved out to Naas and light a fire like this in our wood stove. And I really did not want this to be to be true. I did not want air. I didn't want air pollution to be really that detrimental to our health. But as soon as I started doing research into this, it very much made it obvious that it is, and it's a major public health issue. And so quickly stopped lighting those fires when I got home from work. So in terms of air pollution in Ireland, there's air pollution in general, there's a few different types. There's particulate matter, which is small little particles that are suspended in the air, and we usually talk about PM10s, which are kind of coarse 10 microns in diameter, or PM2.5, which are 2.5 microns in diameter. They're important in terms of their difference because of how deep they can get down into lungs. The PM10s tend to get stuck in the upper airways. The PM2.5s and smaller can get right down into the alveoli, where oxygen crosses over into your bloodstream and can actually get across the blood barrier. I'll talk about that a little bit more in a minute, but that's why it's important to differentiate them out. Other important ones are oxides of nitrogen, nitrogen oxide, nitric oxide, nitrogen dioxide, sulfur dioxide, and ozone. But there's a lot of other pollutants as well. And our main sources in Ireland are residential and transport. Residential being number one, transport being after that, and agriculture actually would be a major source of ammonia and nitrous oxides as well. But we don't have as much industry or and so on, so it's not as much of that's not as much of an issue in Ireland, and because of that, most of our air pollution comes from our homes. This is taken from the EPA report last year on selected pollutants for 2020, and shows the monitoring that happens around the country. So there's actually more monitors being put on stream now in the last couple of years, but it was about 67 in 2020. And while we have no exceedances of the EU limit, which is kind of higher, the WHO limit we are exceeding. So just for context, we are exceeding air pollution levels in Ireland. So I suppose one thing that often is thought about is this is an issue in other countries. So it's an issue in China and India and so on. But air pollution is also an issue in Ireland. So despite we have fairly low, in comparison to China and India, we have lower obviously air pollution levels, but it's still a major issue in Ireland and isn't something that we can just ignore in Ireland. So we have anyone can log on to this. This is airquality.ie, and you can. This is taken from yesterday. Obviously, it's autumn. No one's lighting fires. Everything's green and looking good. But you can log on to this and see what the air pollution is like in your area. And there is an air monitor in NACE that you can look at. And just to talk a bit more about, so air pollution is a significant issue in Ireland and in our towns and villages. And this is taken from January this year from the monitor in NACE. And you can see most evenings there's a big spike in air pollution that occurs when people light fires when they get home. We have one particularly big spike on the 14th of January. And so this is having health effects in to us in Ireland, and you can see it's right at 6 o'clock when people get home, they light a fire, and then it fizzles out by the end of the evening. So it's people coming home, lighting a fire in the evening, settling in, glass of wine, and so on. They're the times when that we get poor air quality in our towns and villages. And in particular, if you have a combination of fires being lit, and then you've got cold, still air, similar conditions that would develop fog, then you get trapping of air pollution over town, and you get an incredibly high spike like happened on this day in January this year. And so what are the sources of this? So this study, and there's been a couple of studies that have looked at air pollution and the biomarkers of it in Ireland. The study out of Galway looked at some pollution events in Dublin, and showed that it's predominantly peat and wood that are causing that, which you would expect because there's a smoky coal ban in Dublin. But so it's peat and coal, but they also figured out that it's probably only coming from a few houses in Dublin, as well. There's a few households. Only 2% of in the CSO, 2% of households in Dublin rely on solid fuels for heating their homes, and they were able to figure out that it was probably only about 9–10% of households in Dublin that were lighting these fires. So a lot of them were, recreational people when they get home from work. There's only about 10% of households that were lighting these fires, but they were having a huge effect across the whole city. So I suppose it hammers home that it doesn't take very many people, it doesn't take very many households to be severely affecting the air quality in our towns and villages, and it's often just a minority of people. This is Dublin, and this is work the EPA have done to map out the average PM 2.5s across the year, and you can see there's a kind of a gathering in the city centre and in the south side and around kind of some of the major population areas. There is also increased levels around roads, and we'll talk a bit more about that. But certainly, it's, as I said, it's residential and traffic that are the main sources of these air pollutants. And similarly for NO2, which is another air pollutant that's more associated with, so the particulate matter is more associated with residential fuel burning and somewhat with roads. NO2 is very much transport, and there is an association along our inner cities and our towns and along our major roads of NO2, showing that the impact of living beside a major road, or living in a city or town. And the EU have estimated that air pollution causes about 1,410 premature deaths in Ireland per year. Most of those caused by particulate matter, 1,300 caused by particulate matter. So there's 363 years lost per 100,000 people in Ireland, is what they've estimated. And across the whole EU, there's about 450,000 premature deaths per year. So it's a major public health issue for us, and so having an impact on air pollution and reducing air pollution will have a major benefit in terms of premature deaths in Ireland and Europe. So how does this happen? And this is quite a busy slide, but this it kind of is an overview of what the mechanisms are for causing these effects in the body. So firstly, you can get direct, so these air pollutant particles can directly cross the air alveolar barrier. So like I said earlier, so crossover from the alveoli in your lungs, where oxygen goes into the blood, and they can cross that into the blood, and then have systemic effects, causing kind of direct effects on the brain, on the liver, on the vasculature, on the bone marrow. The second way is that it can cause inflammation, and I think that this is probably one of the most important things. So it can cause inflammation in the body, in the lungs, and in the body generally, because it's going to all these other organs. And so inflammation, spillover then through various different cytokines can cause cardiac disease, can cause, but can also has been linked with a lot of other diseases. So cardiac disease and stroke, but also there was an article there yesterday talking about it again, that it can cause cancer, it can cause dementia, Parkinson's. All these diseases are linked with systemic inflammation, rheumatoid arthritis, and other arthropathies. All these things are linked with systemic inflammation and these inflammatory cascades that happen, and they are triggered by air pollution. And then then thirdly, can actually directly across via the olfactory nerve in your nose, can directly go up that and directly into the brain and cause direct inflammation there. And it has both short-term and long-term effects. So it can trigger heart attacks, trigger strokes, and so on, but it also increases insulin resistance in the longer term, increases glucose and levels, and causes diabetes, causes obesity, causes vascular dysfunction, blood pressure, atherosclerosis. So it causes these both short-term and long-term effects in the body. Now, as I was saying that one of the main mechanisms is this inflammatory cascade. So you just get a whole lot of inflammation in your body, and if you have that acutely, that can trigger things like, as I said, stroke and heart attacks and so on. But if chronic inflammation causes a lot of other issues, such as vascular disease, cancer, arthritis, and all these various other things. So it's linked. Lots of various different studies have linked air pollution, and in particular PM2.5, with overall mortality in worldwide, cardiovascular disease, including various different cardiac diseases, stroke, and both long-term and short-term effects of that, respiratory disease, which is asthma, COPD, but even COVID has been linked with air pollution, and increased mortality with COVID has been linked with air pollution, and increased susceptibility to infection has also been linked with air pollution and COVID. And then some neurodegenerative diseases like dementia and Parkinson's disease have also been linked, and others such as rheumatoid arthritis, diabetes, chronic kidney disease. So it affects your entire body. And as I was saying, it's this, most likely it's this inflammatory cascade that happens that causes a lot of these issues. One of the interesting things about there was a study on mortality published a couple of years ago in the New England Journal of Medicine that looked at worldwide at mortality with various different particulate matter concentrations. And as you can see from this graph, they've marked out what the various different national and international bodies have marked as being safe levels of air pollution. So purple is initial WHO levels and current US levels in China. Orange is WHO, various different iterations of WHO air quality guidelines. And then this is where the EU and WHO levels sat at the time. And there weren't similarly for PM2.5. One of the most interesting things about this study was that some of the steepest changes in mortality occurred at levels below what the EU and WHO and so on were saying were safe. So the biggest effects of air pollution were at very low levels. And this has big implications, especially in Ireland. We would sit down here on our where our pollution levels are, but even at those levels, there are still effects of air pollution being seen. In fact, some of the greatest jumps and relative differences are at these much lower levels. And so there is essentially no safe level of air pollution. And the lower the better, essentially. And in light of this and other studies, the WHO have since revised their guidelines, so I'll talk about them in a few minutes. Just specifically in Ireland, there's been a couple of recent studies. So this study I did as part of my doctorate research with Professor Williams and others in RCSI and in Trinity. And this demonstrated that in Dublin and Cork, that there were, during winter, that there was an association between ischemic stroke and stroke in air pollution levels in Dublin and Cork. So it's not just something that happens in far away. It is something that is affecting us right here in Ireland. And another study out of the longitudinal study for aging out of Trinity showed an association between having an open fire in your home and developing dementia in later life. And that in some homes, levels of air pollution were similar to heavy traffic roadside. They went out and looked in individual people's homes and tested it, and it was similar to standing beside a busy road. So and both these studies are from Ireland. So there is essentially, as I said before, there is no safe level of air pollution. We can't, you can't just say, oh, we're below EU guidelines, that's fine. No, we have to get air pollution levels as low as we can get them for public health safety. So how do we do that? Well, one of the things that we can do is do personal mitigation. And so one thing that has been shown to help is wearing an FFP2 mask. We're probably all familiar with those now with COVID. Over the last couple of years, they have been worn a lot more and are a lot more freely available, and they are something that can be worn. So if you're in a high pollution area, FFP2 masks are beneficial to helping prevent exposure to air pollution, and there's some studies showing the benefit of that. It's not the most environmentally friendly way of mitigating air pollution, but it certainly does work. It does have to be one of the things similar to COVID. It does have to be an FFP2 mask. Wearing a cloth mask or an ordinary surgical mask doesn't have as much benefit. An FFP2 mask or better is what has to be worn. But obviously that's not a long-term solution to air pollution. Some medications can help as well. There are some studies demonstrating that things like statins that you might take anyway for cardiovascular disease can also mitigate some of the effects of air quality as well in terms of that inflammation. Also aspirin as well is another medication that's been linked. Exercise is an interesting thing. Some studies have demonstrated that the benefits of exercise are reduced if you exercise in a high pollution area. So it has implications for thinking about maybe where you do your exercise. If you exercise alongside a busy road, or if you exercise, in say in the evenings in the winter when there's high levels of air pollution, it may not be getting the most benefit out of the exercise, and so maybe it'd be better to do that exercise in the morning. That's not to say if you can only exercise alongside a busy road, or you can only exercise in the evening, that you shouldn't do it. No, you should. You still get benefit from exercise, but to get more benefit out of the exercise that you do, certainly some studies would suggest that you should move the timing or the location of your exercise to time place where there's lower levels of air pollution. And I mentioned the air quality .ie, which can be very helpful to log on to and look at what the air quality is like in your area before you go planning to do some exercise. One thing that can help and also has benefits from a climate and from a biodiversity point of view is afforestation in our urban areas. So having trees in our urban areas. It's estimated in London that 0.7 to 1.4% of PM10 is removed by trees, and the increase in the tree coverage will increase the amount of PM10 that can be removed. In terms of what trees are better, silver birch trees and elder trees, because their leaves are kind of hairier, can capture more particulate matter. The issue with those is that in winter, obviously there are no leaves, so their benefit is lower. So evergreen trees like yew would be more beneficial. A lot of non-native trees are good as well, and non-native plants. So the dreaded Leylandia that is everywhere across the countryside, that's actually very good at filtering out particulate matter because it's got very small, thin, bulky mass that helps to filter out air pollution. And bamboo is actually very good as well for doing that. I suppose in terms of this, it has implications in terms of planting trees in our urban areas, but also about what you might plant, say, around a playground beside a busy road. So planting, say a yew hedge beside a busy, around the playground beside a busy road would help mitigate the harmful effects of air pollution to children playing there. So things like that to think about when when we're designing our urban areas is important. I mentioned new WHO guidelines. So these were released last year, that have in light of a lot of the studies that show that there is essentially no safe level of air pollution, that the WHO revised their guidelines and brought in a lot stricter guidelines in terms of our compliance. And going back to those charts that I showed you, it shows that we really are not hitting these guidelines in our local towns, like in Naas, but across the country. So essentially anything that has any color apart from dark blue here is not meeting WHO guidelines for air pollution, and anything that isn't blue in this map isn't hitting NH2 guidelines, or NO2 guidelines, sorry. So we have the stricter WHO guidelines have put it on Ireland to do a lot more in terms of trying to meet our air pollution targets. So, and I would imagine because the WHO have released this, that the EU will hopefully bring down their legal targets to the WHO levels, and that will bring a legal incentive to the government to have to reduce down the air pollution levels in our towns and cities and country. At the minute, the WHO guidelines are just guidelines, but the EU guidelines are legally binding. So hopefully the EU will change their guidelines soon. So what can we do in our homes? Well, heat our homes using electricity is the best thing to do. So especially by solar or wind and heat pump, that is the best way to heat our homes. A gas boiler is okay from a air pollution point of view. Obviously, from a climate point of view, it's not the best choice. But burning anything in our homes is not going to benefit or air quality. If you have to, using an eco stove is better. Though if you are going to the expense of putting in an eco stove, I would argue, why would you not just put in electrical heating in your home? But burning it in a stove is better than an open fire, and burning anything in an open fire is extremely harmful. Burning waste is illegal, but burning turf, bituminous coal, and green and wet wood is particularly harmful to our air quality. Using dry seasoned wood that's down below 20% in moisture content, or peat briquettes, because they're drier than turf. Turf has moisture content of 30–40%. They're better, but burning anything is going to cause air pollution. So it really shouldn't be burning anything in our homes at all. The other thing we can do is by promoting public transport and active transport. There are a lot of reasons to be encouraging active travel. Cycling commuters in Copenhagen were found to be 40% less likely to die from any cause over a 15-year period. 15 to 20 minutes a day is all that's required to achieve that. So it's a no-brainer from a public health point of view. And then as you're doing that, you're not producing air pollution, so it's obviously much better as well. Local low traffic neighborhoods reduce air pollution as well, and the evidence is out that happens. There's a lot of LTNs in London, and the evidence from them is that yes, it does reduce air pollution. Because one of the arguments against LTNs is often, oh, well, you're just diverting the traffic around. No, you're not. You're actually reducing air pollution everywhere because people drive less. And then combining clean air zones, school streets, and LTNs reduces the air pollution exposure further. So changing our urban environments to have school streets, to have clean air zones, to have low traffic neighborhoods does have a big impact in terms of air pollution. So just to conclude, many diseases have been linked to air pollution, and it's estimated that air pollution causes about 1,410 deaths per year. Most are from solid fuel burning. And there is evidence from Ireland and from the international evidence that air pollution is damaging our health in Ireland. Diseases with major quality of life effects such as heart disease, asthma, dementia, and stroke have been associated with solid fuel burning. One of the things is that these effects are seen in both the short term and the long term. So if we reduce down air pollution today, we will see the benefits tomorrow. So we don't have to wait a long time. So unlike climate change, which all these things to reduce down air pollution, they also benefit climate change. But the benefits of climate change are obviously in the longer term. Benefits from reducing air pollution is in the short term. It's literally tomorrow, the day after. That is the time frame that we're looking at to see the benefits of reducing air pollution. And as I mentioned there, mitigation is possible, but prevention is best. I actually take a lot of heart from the anti-smoking campaigns. They, it was the given, you go into a pub in the 90s and early 2000s, or before that, and it'd be a smoke-filled, polluted area. But now it's because of that bringing in the smoking ban, there's been a shift in public perception, and now even smoking in at home, and especially around children, is a complete no-no. And anyone who smokes outside in the rain, smoking now, and so that cultural shift by just having a ban in pubs has had a huge cultural shift across society, and I would take heart from that, that hopefully in 20 years' time there'll be a similar view of air pollution. Thank you.
Great. Thank you, Colm. Thanks for that. Really interesting stuff. And I think it's like it's the real it's one of those issues that really, it's where the health and climate issue really meets, isn't it? You know, there's no avoiding that. There are a couple of questions coming in here, if that's okay, Colm. So one is how, and I was wondering this as well actually, how does our air quality compare to other countries or other towns? Like, how are we performing by international standards, do we know?
I think I put it up there that we are at the minute meeting our EU targets. Just our EU targets are very loose. You know, you compare us to northern, to Eastern Europe, to northern Italy. We are obviously a lot better than there. Northern Italy, a lot of the air gets trapped by the Alps, so they actually have a huge, real problem with air pollution there. So we are much better than other European countries. We're probably in the lowest quartile in. We are in the lowest quartile in Europe. So compared to other countries, we are much better, but we can't rest on our laurels. So just because we're not as bad as everyone else doesn't mean that it's still not having an effect in Ireland.
One of the things I noticed as well when you were showing your maps was I couldn't help thinking that's where all our acute hospitals are, in the middle of all of that really bad health. You know, you're sort of bringing people in for treatment in, you know, some of the worst air quality place in the country. And just then, anecdotally, I was in Sweden a few years ago, and the air was noticeably cleaner. And even when I was driving, actually, we were driving in a country area, which was just, there were trees everywhere, and obviously the air in the car is coming from outside, and it was, we actually commented on how clean the air felt. It was just interesting, some of the trees you were talking about, you know. Another question here, sorry, from Jason: is there just one air quality meter in Naas? Do you know where it is located? Seems there are good and bad pockets of bad air around when out on a bike or run.
Yeah, and that's definitely something I've noticed, Jason. So it's the air monitor itself is over there by Tushy's, in Ferry Road. So, and this is kind of a problem I have often with the EPA. So they want background when they're using those air monitors as kind of background monitoring to see what the background levels are. They actually don't want their air monitors too close to a road. They don't want, or to a busy road. They don't want their air monitors in particularly high polluted areas, because they kind of want the background levels. So the one monitor, or publicly available monitor, is on Friary Road there. So it's well away from houses, well away from the estates, and I'd find the same thing too. Out for a run or a cycle, and you can smell it. You can smell the high levels of peat. So yeah, no, it's definitely an issue, and I think having more monitors would definitely give us a better picture as to what's really going on in our towns and villages.
That I am aware, actually, and I don't know if I get a chance to look it up while we're talking. There's also I don't know if you know a gentleman called Kevin Mullen, who's running a scheme in Kildare, the name of which is escaping me. If someone can step in with the information, but it's a, I don't want to say it's an amateur, but it's his own project.
Yeah, I have talked to him before. He has reached out to me before. Yeah. There are some,
so it's not
unofficial,
because he has one, I think, on the main street as well. Okay. That's interesting, but the EPA one is not on Main Street, which seems like
no, and it's well away from any houses or anything like that. So it's not really capturing what's happening in the estates and so on. Yeah.
Okay, interesting. Okay. Sorry, there's another question here. In terms of encouraging active travel, should we be emphasizing the health benefits a lot more, as in both exercise but reduction of pollution?
Yeah, no, and every time I get to talk about it, I talk about that. Yeah, no, it's the benefits of active travel are huge, and as I said, a study from Copenhagen has shown 40% reduction in mortality in people who cycle. So there's a huge benefit on a societal level and from a public health level to cycling to walking. And you know, and I think it is often one of the things that's missing, both from you know, it's kind of there in the air quality, but I think in general with climate change as well, it's the health benefits to both doing the measures to basically, you know, to tackle climate change, and also, you know, but also because of the health impacts that there's going to be to climate change. So I think that's one of the big things that's missing often from the conversation, and it's one of the things that, you know, in Irish Doctors for the Environment we're set up to try and emphasize that,
to make that link
in the debates. Yeah.
Actually, and I was just wondering as well, I mean, we all saw a couple of weeks ago, maybe a couple of months ago at this stage, when the move to ban smoky fuels was, you know, being implemented, we all saw how quickly that debate became incredibly toxic. Do you have any, you know, thoughts or ideas from your experience with, particularly with Irish Doctors for the Environment? How do we stop that debate becoming, like, it just became very toxic very quickly and really risked derailing a very important health measure, you know?
Yeah, yeah, I got mired in some of it. The Matthew McGrath went for me, but yeah, it's difficult. I think, you know, I think it's often about the framing of it when you announce these things, that, and that's why I think having the health impacts front and center is so important. That the health benefits to doing these measures, you know, I actually nearly think this, you know, it shouldn't be the Department of Environment leading on it. It should be the Department of Health. I know they have a lot going on at the minute with everything else, but it should be it's a public health measure. It should be the, you know, it should be the Department of Health leading on it, because it is a public health measure, and that's primarily why we're doing it. So the you know, and one of the issues that came up in the debate around it was this whole thing of the real issue of fuel poverty, and we are really going to see it this winter. But it is a very important issue, and but my argument always is that, you know, bringing in things to help climate, help air pollution, will improve people's fuel poverty. It'll improve their homes. You know, putting in insulation, putting in you know, better heating systems that don't cost as much, you know, cost as much to run, like heat pumps and so on. They will benefit both fuel poverty and air pollution and climate.
Yeah.
I do think there has to be a bit of a thought about how we do that. So, you know, is the grant system the best way? Should it be more a loan system, or a bigger grant? You know, in Italy they have 110% grant for doing up your home, and to, you know, take into account the costs of you know, say renting somewhere else, or, you know, the disruption to your to your house. So things like that. You know, especially if we targeted those at people on lower incomes, to try and benefit the air quality in both people's homes and outside. But one of the things, you know, there was that 2,800, wasn't it, deaths per year that was being touted as, you know, being caused due to fuel poverty. But that was actually just an error. That was a misreading of the original paper. Most of those deaths are actually, it's just 2,800 excess deaths per winter. Not, it's hypothesized that fuel poverty is part of it, but it's actually just, there's 2,800 excess deaths per winter on the entire island of Ireland, and that would include the 1,400 deaths a year in the Republic from air quality. So it's not, you know, there was a bit of a misuse of figures as well by some people to go against the measure. and but I do think it's, you know, it's about the messaging, and it's about making sure that the plans, there's good proper plans in place to tackle, you know, so say, you know, having, you know, loans, 0% loans or things like that, to, you know, and saying we will provide these for you as you announce the intervention.
Yeah, absolutely. We have a question in here as well. Do we have an age profile for the deaths attributed to air pollution, or the difference between urban versus rural? I'm not sure if you covered
certainly that. Certainly children, and infants and children, but also older people are more vulnerable to the effects of air pollution. You know, older people, probably because they have less of an inbuilt reserve, you know, to tackle, you know, to take on any insults, that they are more vulnerable to air pollution. We certainly know that. The difference between urban and rural, we don't really, air pollution isn't so much an issue, outdoor air pollution isn't so much an issue in countryside, but in our towns and villages it is more of an issue. But if you have a fire in your home, like I mentioned the study from Tilda about dementia, if you have an open fire in your home, you are more likely to develop dementia. And that doesn't matter where you live. That it doesn't matter whether you live in an urban or rural area. If you have an open fire in your home, you're more likely to develop dementia. And so it is often about what the you know, you're doing in your own home that will affect it.
I definitely don't think that's something that would be the people would generally be aware of. And then just I mean, I don't know if there are any more questions there, but I was just going to finally ask, do you feel, I suppose I'm particularly again asking about your work with the Irish Doctors for the Environment, do you feel this message getting through, say, on a policy level? Sometimes there's a difference between what we're hearing discussed on radio and maybe consumers are hearing, but do you feel that we are actually breaking through on this, that we are going to start seeing changes, legislative changes, and you might be more aware of stuff that's happening in the background, you know?
Yeah, I am optimistic that I think this, I think there will hopefully be a ban on smoky fuels brought in. I would be optimistic about that. I think there is a determination in the Department of Environment to get that done. So I do, you know, I would be optimistic. You know, I would like to see it go further, obviously. You know, but I do think that there is an acknowledgement, even amongst some of the rural independents, that this is an issue. And I think it's similar to the farmers. I think a lot of it is reassuring people that they're not going to be worse off because of this. When the smoky coal ban was brought in Dublin, like they went out, you know, there were people who went out to Ballyfermot and helped people transition over to cleaner sources of fuel. You know, it will take work. You can't just do it, but I think it is. You know, so I think if we did that there would be a buy-in, you know, from most people, because, you know, most people don't want to be, as they get older, don't want to be looking turf for, you know, coal in and out and lighting fires and so on. It's a lot of hassle. It's a lot easier to have a heat pump. So I think, you know, you can show people that their lives would be better if they're, you know, both from a health, from a, you know, lifestyle and so on. That would work. But I am getting a lot of people say that they're not lighting fires as much. Sometimes quite angry, you know, not angrily, but, you know, annoyed. But
they miss them. And then actually, just one last question in here from Jason. Actually, who do you recommend that we have to try to get things like 110% grants in Ireland? And we want to upgrade our homes, but don't have the cost and don't know the best way to lobby. Email. I think it's a really good point. I've been on a couple of conversations this weekend where people saying, I'm starting the conversation, and people don't know where to start. People get a little bit, it just seems like such a massive job of work to upgrade your home, and I think people are a bit put off by that. So who do you think we should be screaming at to make it easier?
I think your local TDs, obviously. So your local TDs would be the best place to start, and to lobby them, local TDs and senators. I think it's important to. I think being involved in Irish Doctors Environment has helped kind of you find. It has helped me anyway find a group of people that think along the same lines, and there are a few other kind of groups, so like PPN, or either community groups such as the critical mass, or there are some professional groups being set up. So I know there is a lawyers for group, lawyers for the environment, or something like that being set up. Or if you're in healthcare, Irish Doctors Environment isn't actually just doctors, we're a broad church, so anyone in the health area can join. So pharmacists, nurses, so on, we're a broad church. And so to get involved in groups like that as well, and find the critical mass of people, find a group of people that will help you.
Colm, you're prompting me to do a couple of shameless plugs, if that's all right, if everyone so, and I think that's a really good point, that and that's, as you say, what PPN is about. It's about community groups and giving groups voices, on whatever their issue is, and then PPN can try and amplify that. So I know I find with the Irish Doctors for the Environment, it's a particularly good group for very clear statements on health and climate issues. Do you know what I mean? So whether it's I've been known to steal the odd paragraph from statements. So as you say, if you are approaching a TD or anyone else of influence in your community, I would actively encourage stealing facts and data from Irish Doctors of the Environment. And you've a great very active on Twitter, I think, is the main vehicle. Is it for
yeah, Twitter, and we're on Instagram as well, actually.
Okay.
We're not on Facebook.
Okay, yes. And you've also mentioned, again, Nice Cycling campaign is very active on Twitter. We'll soon be kicking off on Facebook and Instagram. And the new cycling campaign, again, they're the main cycling campaigns that I'm aware of in the county. I may be missing a few, so that's accidental if I am. But they are great ways, as you say, you can add your voice to those groups who at the same time, at the end of the day, they might be talking about active travel, but it's all interlinked,
Yeah, and Nace Biodiversity as well is another
Nace Biodiversity group as well, which is very active on Instagram and Facebook as well. So and we
also have WhatsApp groups as well. So Irish Doctors Environment have a WhatsApp group, Nace Cycling, we're setting one up. Where there can be discussions.
And it all helps. It all helps, Sometimes you feel like you're not getting anywhere, but it's all building up. Colm, thank you so much for that. And thanks everyone for joining us this afternoon. I hope everyone learned something and left with a bit of a sense of optimism. I think we're going to get the changes we need anyway. So thank you so much for that. And sorry, there are 2 more events today. There is one event at 4:00 on psychology and the climate crisis, and one on sustainable communities, particularly food sustainability, at 6:00. I think that is, Grace, is it? Yeah, great. Yeah. Okay. Yeah. So thank you so much, everybody, for joining this afternoon and for joining the other events this weekend, and we will see you soon.